Sister Pauline Pongo, pediatrician from the Congo, Republic of Congo, working in Papua New Guinea, Ley City. I would like to give you a little bit story on my practice here in the Clinic Center of Mercy as a pediatrician with the many children we are seeing. Actually, our clinic is catering more kids than the bigger population. Like our catchment area is having a population of 22,000 per catchment area, and most of them are children. And many of the children, they come to the hospital with the skin condition. The common one is scabies, and some of the skin condition are not really understood what kind of these skin conditions they are having. Also, many are coming with the wounds. Big wounds, which here we call it mostly sores. Also like yos. Yos are very common here. I remember it was my first time to see yos here in Papua New Guinea. At my home, I have never seen yos. Yos are very common here in Papua New Guinea. And also malaria is still #1 and is killing many children because they bring them to the hospital very late. And the challenge we are having with malaria, yes, we are doing the rapid diagnostic test or blood slide. But when the rapid diagnostic test is negative, to come to do blood slide, many people cannot afford the little money like 10 kina to pay for their kids to get the blood slide done. So it's a difficult condition. You can see that, yeah, this child is really having the signs of severe malaria. But now how to diagnose with the blood slide so that we can get accurate result, so that we can give accurate treatment. And if you diagnose a child with severe malaria, it is also very difficult. Like in our clinic, we are not having artesunate, which is the IV treatment for the severe malaria. What we can have is artemether, but sometimes the artemether is run off stock. Like recently, it's about 1 month we are not having a artemether injection in the clinic because the supply is over. So these are the kind of challenge as a pediatrician. You get children with severe malaria, but you don't have the right medicine to treat them. Because when you think of the complication of severe malaria, it can bring cerebral malaria, which can damage the brain for the children. And then these children might end up with complications and they develop even meningitis. So these are the conditions which are really difficult to treat here when you don't have medicine. Other conditions which are presenting most in the clinic is the upper respiratory tract infection. Very common. And especially at this time, as we are during the time of the pandemic, is really challenging. Because like in the clinic, we see about more than 50 children per day. And many, like 40 of them, they are coming with the upper respiratory tract infection. But the common thing now, which is there, is very hard. And in this upper respiratory tract infection, they end up with pneumonia. Pneumonia brings them to severe pneumonia, which is a life-threatening condition for the children. So in this condition, yes, you need to treat them with the IV medication. Like our clinic, it's only for daily clinic, it's not for admitting. So these children who are having severe disease, we need to refer them to the general hospital. And our general hospital is overcrowded because it is the only hospital in the province and is catering for many patients around, because in this province we don't have a district hospital. So where our clinic is located, it is a bit in the central town, so we are catering many patients. So because we don't admit, we need to refer them to the general hospital, and there is a queue. Sometimes some of them, they give up on the way. Some of them, they reach there, they're not treated on time. Some of them, they just end up dying at the emergency department before even the service is done. So other conditions is like typhoid is also very common, and the diarrhea. And the diarrhea and typhoid is very common because the population we are serving, they are living in the settlement. And the settlement, the living conditions are not really well. And also the most threatening disease now there where we are working, it is TB. TB is really devastating because from children to adults, they are getting different types of TB meningitis, TB post disease, or pulmonary TB, or TB glands. So all these kinds of TB is really devastating to the population. And what is worse, most of the time you don't have the supply, the anti-TB medicines. Sometimes it's out of stock. Like during the month of December, we did not have TB treatment in the clinic. So the patient stayed for almost 1 month without treatment. And you see, we as a clinician, 1 month of not having TB treatment, that means it will lead to resistance, and then these people can develop complications on TB. So TB is really life-threatening. Like our data, they are showing that we had more than 450 new TB cases which we registered in our clinics. This number is very high. And this is due to the settlement where they are living. The houses are very poor, no good ventilation. So it's leading on this condition. And also as a pediatrician, when you don't have any service, so you just use whatever you have been learning before, but the new update or in service for other people to help is very hard. Like the general hospital currently is having only one pediatrician, and there is a new one who just arrived now in the province. So you can see that the specialist is very difficult here in our province, so it's very hard. And those one, when they become sick, we send them to the general hospital. It's hard. Why? Because sometimes the investigation are not done on time, and then people end up developing some complications. So that's a little bit story I would like to give. Again, my name is Sister Pauline Pongo, pediatrician working in the Lay City in Morobe Province, Papua New Guinea. Thank you.